we start, just for people who have just joined, if you can type in the chat your name and where are you joining us from, so we can see how many people from different parts we gathered here. And my name is Ola. I'm a first year biomedical student based in London. And I'm here today with my two colleagues. And if you could introduce yourself, that would be amazing.
Hi, I'm Hannah. I'm a fifth year medical student based in Oxford.
Hi, I'm Rhiannon. I'm an activist and student based in Cambridge in the UK.
Okay, and if we can move on to the next slide. Okay, so this workshop will last around 1 hour and we will go into the two parts. We will be asking you questions, so be ready to interact. And the first part will kind of explore more of the social injustice perspective. And the second part will focus more on our movement, how we build capacity and how we advocate what we have learned. And if you have any questions, please type in the chat, and as we go, and we can try to answer them during or at the end of this section. If we can answer, we will get back to you. Okay, and if we can move on. Okay, so the first part is an introduction to why climate justice is actually a health justice. So I'm going to start off with what I was taught in school. So what I was taught in school is that since Industrial Revolution in the 19th century, gases like carbon dioxide and methane have been building up. And this was obviously caused by deforestation, manufacturers, but most of all fossil fuels. And this caused global warming and ozone layer depletion. And this is kind of, I think, obvious for people that are at this conference. But this is actually everything that I was taught in my school throughout 12 years of education, which is kind of a long time, I believe. But what I was not taught in school is that environmental changes, it's not only the climate crisis what it's about, but it's also about political and cultural issues. So as soon as I realized how harmful climate crisis is, the first thing I actually did, and I think the first thing many people do, is to start individual changes because we feel responsible for what is going on, which is kind of normal. And I think a huge role in this plays social media posts like those from BP and Shell, the biggest oil and gas companies, when they post surveys about your carbon footprint and how you can reduce it. But actually, I don't think that people do have a responsibility for not for a climate crisis. We have a responsibility, but to stay informed and demand for the changes. Because as you can see from this lovely article from Guardian, as individuals, we cannot really end the climate crisis today. And furthermore, climate crisis influences us not only as individuals, but as a groups of people as well. And these are unequal influences. And if we can move to the next slide. Yeah, and so, yeah, from the medical perspective, what we are taught in the medical school is to think about the individual patients, but in the global and public health, we need to go beyond that because climate is a social justice issue as well. And we need to look at it in a more complex point of view, because where you live in the society actually plays an enormous role to the benefits that you get. And I found this lovely diagram that you can see here. So it represents a spectrum of these societies, so people living in the same city. And on the right-hand side, you can actually see people that live in the areas with higher poverty, which is often connected to racial minorities as well. And on the left-hand side, you see people in much wealthier part of the society. So one thing we know is that living in the areas that are exposed to the higher poverty often have few environmental benefits compared to the wealthier part. And what do we mean by benefits are basically green spaces like parks or bike paths, and basically more alternatives. So people living in those wealthy parts can stay healthier in terms of having cleaner air or cleaner water. So one part of the society seems to be getting a lot of more benefits than the other part. But what the other part gets, and if we can move on to the next slide, and what the other part of the society gets is actually a lot of burden and environmental and health burden. And if you look at the arrows, they show that it's an increasing burden and increasing benefits. And the burdens include waste facilities, energy production, or transportation facilities that are in those more poor areas like airports, for example. So those people also have few alternatives because they are being exposed to chemicals, pollutants, or pressing issues that influence their health, in contrast to the wealthier part, which might be more not only economically powerful, but also more politically powerful. So they are being able to control things like laws or regulation, might be better represented in governments, which, going back to the social and group changes, they have a real influence on what is going on in the whole city, for example. So if one person from this more poor part of the city wants to change their life, it is often not really effective or not as possible at all. And this is basically something that no one teaches us at school or at the university. And I just wanted to base it in a real life example. And if we can change that. Okay, and it's the COVID-19 example, which might be kind of obvious again, but it shows increasing and existing inequalities in the context of environmental and health-based problem that we have right now. So these peaks are from New York City on the left-hand side and on the right side in London. So these show increasing death rates in those cities. So if we look at the Bronx in the New York City or South London, Brixton, this is kind of deprived borough, we can see that those people were much more affected by the COVID than people living in central London or in Manhattan, for example. And again, this is something that we are not really taught at medical schools. So if you can ask us, are we taught anything about planetary health or social justice at school? Yes, the next slide will be awesome. There's actually a study that shows that not really. And there's this amazing initiative run by Planetary Health Report Card. We will send a link, I think, in the chat. And it explores, is a student-driven and explores how well universities do when you look at them from the planetary health perspective. And what we can see is that it is not really a great change in the curriculum, for example, because the best unis in the United Kingdom got B or B minus. And my university, my medical school, is not even here in the first 15 schools, which is kind of sad. So we know these problems need to be advocated. So this is why Students for Global Health are here, which is an organization that we represent. So we are a movement that, through education and advocacy, acts for equity in health. And every year we run a coordinated theme, which is the main theme of the whole movement. And this year's one is a social driven one. So it's a health justice and climate justice. And this is something that Hannah will tell us more about. And I will pass on to Hannah now. Thank you.
Yeah, so now we're just going to talk a bit about the links between climate change and health, but more importantly, why climate justice is health justice. So as I'm sure most of you know, climate change is and will have widespread impacts on health. And these will be direct impacts and indirect impacts, with the direct impacts being a direct result of changes in climate patterns and temperatures, whereas the indirect impacts are a result of extreme weather events. And a particular indirect impact to note is the impacts that climate change will have on health through its impacts on our societies, politics, and infrastructure. And this includes compromised access to and functioning of our health services and systems. It's also important to note that the destruction of habitable environments through natural disasters will also force migration of vulnerable communities, which will trigger a lot of psychological distress and social conflict. So these wide-ranging impacts highlight the need for climate change adaptation and mitigation, but also the need for environmental and social justice. So climate justice is health justice, and this is something that we at Students for Global Health have been trying to to push forward and make people more aware about. Because climate change isn't just an environmental issue, since it's the result of exploiting people and their resources. And so its impacts will drive further inequality. And generally, the impacts of climate change will be spread unequally across populations, with the poorer communities being the most vulnerable. And of particular note is the fact that Indigenous people are extremely vulnerable to the impact of climate change, since they are particularly dependent on forests, which have been long exploited for logging and land use, and they've been dispossessed of their lands and territories and resources for hundreds of years, which has meant they've lost control over their way of life. And the particularly sad thing about this is that Indigenous people, despite the significant impacts that they experience from climate change, they're really left out from meaningful participation in decision-making processes. And it can be really difficult for them to access spaces on local and national levels, let alone on a global level. So with this in mind, Students for Global Health has been collaborating with Climate Action Malaysia, or also known as CAMI. And they are a youth-led Malaysian climate activist group who are dedicated to empowering women, youth, and marginalized communities. So we've been paying Indigenous people to produce artwork about climate change, which we're aiming to then have shipped over here and for us to drive it down to COP26 to present it to an international audience. So the idea is that we pay these people for their valuable work and raise the voices which are otherwise not heard. And it's kind of a different type of organizing. So we're using artwork on an international level, and expressing and viewing climate change through art and cultural traditions is a really powerful lens, and hopefully something that will touch people in a different way to kind of the scientific and factual basis. And really exciting for us was that we had an article published about our project in Malaysia's biggest newspaper, which you can just see the title of here. And when we're talking about inequality, it's obviously really important to remember that here in the global north, we're the ones contributing the most to climate change, and developed nations are responsible for over 70% of the total greenhouse gas emissions since 1950. And whereas developed nations, who house around 87.5% of the world's population, are the ones who will face the greatest climate change derived threats to health. And because of the UK's historical contribution to climate change and carbon emissions, it places the UK in a position of greater responsibility to mitigate these global impacts of climate change. And that's why in last December in 2020, alongside 3 other UK organisations, Students for Global Health launched a letter to the UK government, which demanded health and climate justice at COP26, and added an angle that others were not really touching upon in this space. So we demanded that the UK take responsibility for its historical emissions and commits to a reduction in national carbon output that reflects this, as well as demanding a permanent stop to all fossil fuel extractive projects and cessation of funding to exploitive fossil fuel projects abroad, which is obviously really important. And we also asked them to guarantee a fossil fuel-free COP26. So this means that we ask them not to accept sponsorship from or allow lobbyists from the fossil fuel industry at these talks. And climate injustice is also present within countries, which is important to remember. And here in the UK, wealthier households are known to contribute more to emissions. And the consequences of things like air pollution and the lack of access to green spaces usually falls on lower income communities. So for this reason, we also ask that the government prioritise green jobs, and Students for Global Health is supporting investment in a Green New Deal. And this aims to create safe, well-paid green jobs and sustainable infrastructure here in the UK. And it ensures a just transition for workers and centres marginalised voices. And it also prioritises health and addresses health inequalities, which many of us as members of Students for Global Health already work on. So these are just a couple of case studies that basically exemplify the disproportionate impact climate change can have. So I don't know how we're doing for time. I think I can't actually see on my screen, but does anybody have any ideas about how climate change can disproportionately impact those of a different gender? Or have any of you heard of the case of Ella Kissy Deborah, who's a girl who lived in the UK? I don't think I can actually see the chat. So if anyone puts anything, if one of you could just let me know.
No worries. Yeah, if anybody has like any thoughts on how climate justice is related to gender inequality, or if anyone is familiar with the UK legal case of Ella Kissy Deborah, please do pop any thoughts that you have in the chat. Otherwise we can like talk through them a little bit. But yeah, really keen to hear if anybody has any experience of any of these issues. We'll give you like a minute or so to pop any thoughts you have in the chat. Yes, I can type the questions in the chat. So question 1 is any thoughts on the relationship between climate change and gender? And 2, have you heard of the Ella Kissy Deborah case in London? And if you haven't, no worries at all. We'll talk a little bit about it. And thank you, Felice, for your kind comments. That's very nice. And Leia has put, women are the first victims in the climate crisis, but also crucial actors to tackle climate change. Yes, that's absolutely correct. And as you can hopefully see from this graphic. So Henna, did you want to talk a little bit about the Ella Kissy Deborah case?
Yep, sure. So Ella Kissy Deborah was a 9-year-old girl who lived in London. And in 2013, she died of what was thought to be an exacerbation of her asthma. But actually in December last year, a coroner in the UK concluded that her death was caused by her asthma, but importantly that this was an asthma attack exacerbated by, quote, excessive air pollution. And this was the first time a person in the UK has had air pollution listed as a cause of death. So it was obviously a very powerful thing and something that was really important to be acknowledged. And research was actually then done by the Mayor of London, who found that air pollution disproportionately affects individuals that live in London with high proportions of Black, mixed or other ethnic groups compared to to areas in which there's a high proportion of white individuals. So it really showed the inequality and that marginalized communities are far more impacted by things that affect the quality of the environments they live in. Does that cover it okay? Does anyone have any questions about it? No, I will move on. So another thing that's really important to think about is the link between climate change and colonialism. I don't know if anyone has any thoughts on this, because that could be quite interesting to get some perspectives. I'll just give it 30 seconds and just share in the chat if you have any thoughts. I'll just keep speaking then. If anybody types anything, just Rhiannon, just speak up and let me know. So yeah, the link between climate change and colonialism, so the industrialization and development of high-income countries is basically based on their exploitation of resources from the countries that they previously colonized. And although formal colonialism has come to an end, this exploitation is still going on because many of these nation states that were formerly colonized then continued on the tracks that were laid down for them by the colonizers, and they continued processes of environmental destruction under banners of development. And this meant that thousands of communities were evicted and displaced in development programs. So one particular example could be deforestation, which has taken hold across many former colonies. And for example, between 1960 and 1980, Indonesia's timber exports rose 200-fold, and the timber exports of Cote d'Ivoire rose from 42,000 tons in 1913 to 1.6 million tons in 1980. and now less than 3% of this country's forests remain. And between 1900 and today, around half of the developing world's forests have been removed as a result of deforestation. So obviously the impact is severe and something that we really need to be thinking more about. So it's important that we, in the climate movement, address this multifaceted reality and think about all the different narratives from people around the world. And if we really want to tackle the root cause of climate change, it means that we have to address systems of oppression like classism and racism and capitalism. Otherwise, we're not really tackling that root cause. So what have we been doing? What have we as students for global health been doing? Well, in our work, we've been trying to emphasize the injustice and inequality that is so closely intertwined with climate change. And it was really important for us to try and include voices of people of color and the communities that will be most impacted by climate change. And we did this, for example, through a partnership with CAMI, which I discussed a bit earlier. And we've also been offering some specific teaching on the relationship between climate and health justice. I also discussed a bit earlier the letter to the UK government we wrote, which demanded health and climate justice at COP26. And also the Health for a Green New Deal, which is more UK focused, but asking for green jobs and better infrastructure changes. And the justice and rights focused lens has been something we've been trying to push to all the other organizations we've been collaborating with. So it's something that we've really tried to focus on. And I think Rihanna will talk a bit more. Oh no, it's on to Ola actually, we've got a breakout room.
Yes, now we are moving on to breakout rooms because we want you to engage and to share the thoughts that you have with us. So we're going to split in 3 breakout rooms and we will have 7 minutes to discuss 2 questions. One of them is what would be one demand for health and climate justice, and the second one is how you can tackle the health impacts of climate change in a just way. We will be facilitators, one of us in each room, so don't worry, I will just pop up the questions in the chat. They are also here, but I don't know if we can see the presentation from breakout rooms. So yeah, so anyway, we have them in the chat. So please feel free to discuss as we join the breakout rooms. And I don't know if I think I can really, Ryan, can you do this? Because I don't think I have an option as a co-host.
Yes, I can put people into breakout rooms. Okay. Okay, great. I just need to give me 1 minute to make sure that there's each one of us in the breakout rooms. Okay, yeah, that's perfect. Okay, so we're going to pop you into breakout rooms and we will take the questions with us as well and discuss them. We'll be in the breakout rooms for about 7 minutes roughly, and then we'll come back and discuss. And then for the second half of the workshop, we're going to talk about what we've learned in terms of movement building. So I'm just going to open the rooms now. Oh, yes, I need to give everyone the ability to unmute.
Sorry to the people in my breakout room, got cut off then. But yeah, thank you guys, all of you, for contributing.
Thank you guys in my breakout room as well. In the middle of the sentence.
Yeah, Ola, what were the main things to come out of your breakout room? What did people say?
Okay, so we started to talk about actually I started to talk about me being afraid of the thing that we are in such a little bubble of people that know about climate crisis, and that this is my biggest threat and my biggest I don't know, I'm afraid of it, that I think that everyone knows about climate justice or everyone knows about climate crisis, but actually not everyone, like young people, are aware about it, when often I forgot it. So yeah, that's what I was gonna say before breakout rooms ended.
Cool. And Henna, did you have anything fun to come out of yours?
So yeah, I think what we particularly touched on was like government corruption. It was brought up that, you know, it's not just about colonialism and in the past, but government corruption now, and we have to be holding our governments to account, and the media as well. And Santiago from Brazil was sharing with us how difficult it is over there right now, and how difficult it is for people of colour and Indigenous people and other marginalised communities. So it was really a really special perspective to have, but obviously very, very sad to hear. So that's kind of what we touched upon.
Brilliant. Yeah, and in ours we talked a lot about having institutions that are standing up for climate justice, you know, and supporting the work of researchers and activists, but we also talked about green jobs and having people whose job it is in government and in society to look after people and planet. So for the last kind of 15-20 minutes, what we're going to do is we're going to talk about what we've learned about how to organize and create change from, and this is obviously just in our context, but hopefully it has some useful lessons for people wanting to make change in other contexts as well. So Henna, do you want to share the screen again, and then I will talk through some of the work that we've been doing.
Is that working?
Yes. Okay, so in this part we're going to talk about, like I said, what we've learned from trying to tackle this issue in our community. So this was kind of our plan when we first kind of founded our project on climate and health justice in September 2020. And because our organisation hadn't worked on it before, our initial phase of the project was education. So we didn't feel comfortable kind of launching in with getting everyone to do activism, but we thought it was really important for people to like have the knowledge before we start asking them to kind of sign letters and stuff. And then in phase 2, we've been looking at more grassroots organising and activism. So Henna, if you go to the next slide. So something that we found was really, really, really essential for this kind of work, and I'm sure lots of other people have found it too, is building a dynamic and supportive team to work on the issue. So there's myself, Henna and Ola, who you can see here today, but there's actually about 20 of us who run this program within our organisation. And we found it's been absolutely essential to maintain a good team structure and to work in kind of shared ways. When we were talking about climate and health justice. So one of the things that we did was we worked in an emergent way. So we weren't super rigid with what we were doing and why. So we kind of thought about taking opportunities and seeing what works. So the roles in our team are very flexible. People have opportunities to develop different skills. And whilst we had our kind of broad plan, we didn't kind of stick to it rigidly, and we adapted to the different situations that have come up. But it's really important in your team to give people the space to develop their own skills. So if they want to work on something, they can do that. If they want to switch and work on a different project, and that's really helped to keep people interested and motivated. Because one thing that's really common, and I don't know if any of you have experienced this, is activist burnout, where people who are really passionate about issues work really hard and then they kind of fizzle out and crash. So we've have a culture of like rest and care and taking holidays when you need holidays, and also being able to change projects and try new things to keep people motivated. And something that we also try and do is embed justice in the way that we organize as well. So we try to make sure that we're partnering with people who we feel kind of stand with the same values, that when we have events we invite, you know, most affected communities to come and speak, but also within our own team we want to make sure that everyone can contribute. It's as least hierarchical as possible, and yeah, so that's kind of what we've done for team building. And Henna, if you want to skip over the next slide, we can come back to it if we have time at the end actually. Thank you. So alongside kind of building a good team environment for climate and health justice, what we have found is it's really important to build capacity. And this kind of comes in two forms. There's the knowledge side, which is obviously really important, but then there's also the ability to use that knowledge to make change. And this was something that we felt was also really missing in our organization, was that even if people did care, they weren't quite sure what to do about it after that. So this is our kind of capacity building pyramid. And so first we started with our own team. So we had internal workshops on skill development, like being able to teach, presenting at conferences, which is why we're here, and how to do political lobbying. So we had that for ourselves so that we could get better. And then our organization has a few thousand members. So then we focused on making sure that our members were confident enough to work on the issue, and that they had the skills to make change. So we ran a Climate Change and Health 101 training series across the country. So we had in 5 different regions of the UK, we ran online training sessions to give people basic introductions to the field. But then we also ran trainings on how to lobby your government representative, how to create campaigns, how to do effective advocacy. So we did 2 different types of capacity building, one on the topic itself, and then a second one on how to turn that into change. And then the third kind of capacity building that we were hoping to do was, of course, to bring this to more people, not just within our own organization, but to make sure we were talking about these issues and raising awareness with the general public as well. So we ran a huge climate justice webinar series, which was open to loads of people. Yes, hopefully our presentation will be available. I'm not sure how, but I'm sure we can work it out. What we did with this work was we ran lots of open sessions kind of throughout the year for anyone to join, not just from our organization. But we also work with universities in the UK to put climate change and health on their curriculum, because even though we're a few thousand members, we're never going to be enough. We need everyone to know about this issue, about climate change and how it impacts health. So we work with institutions in the UK to get it onto the curriculum. So if you want to go to the next slide, here are just a couple of examples of what we were talking about. So within our team, we had skill building on things that we all wanted to get better at, like knowing how to teach. Within our organization, we had training on the basics of climate change and health so that everyone felt confident on the issue when it came to doing campaigns. And then we also had opportunities for people to become part of the teams who are trying to change climate, how climate is taught on the medical curriculum. So people could become a representative, and then they got given loads of resources to try and advocate for change at their university. And if you have any questions or comments about this section, please do put it in the chat as we go along. So if you want to go to the next slide. So these are some of our reflections on getting people involved in your advocacy and your education. So, you know, we had this great team, we had a great capacity building plan, but how do you actually get people involved and interested? And these are some of the things which we found worked really well. So when you're inviting people to do a campaign or to join a webinar or to write to their local representative, something that we found was it was really important to make it easy to do this and also flexible. And what I mean by that is that it's not just there's one chance to do it and then that chance is gone. So we tried to make sure that when we were asking people to do things, the opportunity was open over a long period of time. So there were multiple points at which you could get involved, at which you could do a small thing or a big thing. So you have kind of different levels. So if people want to do like more work, then there's something for them. If people have 5 minutes, then there's something for them. And if people can only, you know, just share something on Twitter, then there's something for them as well. So making sure that people who have different levels of capacity and different time can still do something, and having it so that if you can't do something 1 week, in a couple of weeks time, there's, you know, either the letter is still open so you can still sign it then, or the opportunity has been updated so you can still do something then. So this is something that we found to be really important, especially for students, because of how like varied the timetables are. We also found with our communications, it was really important to have them clear and accessible and to have strong branding. So we kind of tried to make sure that all of our posts follow a kind of same kind of color scheme and same kind of vibe, but also that they kind of follow on from each other. So if we're going to ask people to sign a letter, first we do some communications about the issue. So we might talk a little bit about the UK government's responsibility for climate justice, and then a week later we say, okay, now we're going to ask you to write to the government about climate justice. So we kind of had this nice follow-on system where things would follow each other. And it was also, we tried to make sure that things were really clear, so clear instructions for people and accessible. So you didn't have to be a medical student to understand what we were talking about. The other thing, oh no, sorry, go back. I've still got more to talk about on this slide, sorry. And then the other thing that we found really useful was making things action oriented. So if you're presenting something that's, you know, really troubling for people, or you're highlighting an injustice, trying to link it to something that people can do, and making sure that there's opportunities open if people do feel really strongly and want to get involved to put their energy into something, and making sure that you have opportunities for people to take action. Another thing that we have found has been really important is showing people that we're in this for the long run. So this isn't, you know, a short-term project, which, you know, if they miss it 1 week, there'll be a different one the next week. We're going to be working on this project for years, and we want to make sure that kind of people know that. And I think the more that we've been working on it, the more people have been like, oh, like they're really in this for the long run. There's lots of opportunities, let's get involved. And so this means that people have plenty of opportunity to learn and develop. And it also means that we can invest in longer term projects as well. And finally, something which we thought was really important was also showing the positive. We talk about justice a lot, and we never go around saying, oh, you know, climate change isn't really that bad. We never say that. But what we do say is, look, these are the things that our team has done or that you've achieved. You know, we're doing X, Y, and Z. So for example, the government actually agreed to 1.5 of the demands of our letter. So it was really important for us to share the letter was, you know, successful in this way, and you did a great job. And people have found that really encouraging, and it helps people stay motivated to stay involved. So if you want to go to the next slide, please. So these are 2 examples of really tangible things which we feel have helped enable people to get involved. So the first thing on the left is an example of an action pack. So this is when we're running a campaign, this is what we send out to our members and people who want to get involved. And what this is it's a pre-made pack of things, email templates, social media posts, and other ways for them to get involved, so that it's as little work as possible for them to share the campaign and to get people they know involved. And we have found these action packs to be absolutely invaluable. And then the thing on the right is some social media engagement that we did with the COP26 climate justice letter. So we had a communication strategy for the event, which centered around having clear and informative graphics of what we were doing and why, but we used lots of different mediums to get the message to people. So we had these short videos, which you can see for people who didn't have much time, but we also had a report for people who wanted to read about the issue. We had a webinar for people who wanted to hear about the issue. And we had, it was open for weeks to give people time to get involved. And what we found was it kind of snowballed. So in the first week, we had a few eager people getting involved, but not so many. And then after that, it kind of snowballed and more people got involved over the following weeks. So if you want to go to the next slide. So Finally, just to close, I think something that we've learned is that we can't do this by ourselves, either as individuals or as an organisation. So what we've been working to do is to try and movement build and to try and make these links between climate justice and health justice with other health organisations or other climate organisations. And what we especially do in these areas is we try to represent the youth voice where it hasn't been before, or to bring the more radical justice or justice oriented lens to organizations which might be a bit less radical. So this has worked really well for us, and we are now members of lots of different organizations and influencing lots of different organizations which we weren't before. And for many of our projects, we've done them in joint with other people. So for example, the letter was a collaboration with 5 different organizations, and we got several Royal Colleges of Medicine in the UK to sign on. And on the screen are just some examples of other people that we work with. So if you want to go to the next slide, or actually no, the slide after that. I think that's enough speaking from us. And if anybody has any questions, please do pop them in the chat. We've got about 5 minutes. And we'd love to hear your thoughts, anything you have to share at all, that would be brilliant. So yeah, and I guess if you leave the contact information on the screen, people can write that down if they want to get in touch as well. Thank you so much for all your really nice messages, everyone.
May I add one point in terms of movement building?
Of course.
I think in that case, it's really crucial. Not if you want to come from the way from raising awareness to taking concrete action. It's really crucial to touch people's emotions. It's not about making clear that people starting to see what climate crisis, how climate crisis affects our health. But when people start to feel on that, when we can touch the emotion of us, that is the point when the movement starts to go further and can increase.
Yeah, I think that's definitely really true, and I think we try and use the health angle to bring it to people's emotions and help people to hopefully understand what it's like, because people feel health so strongly and personally to them. But yeah, that's a brilliant point. Thank you so much.
Thanks. Yeah, because I think then it really comes clear that it affects ourselves, that it affects my, your, and all of us health. Yeah.
Thank you for your comment as well, Teddy. It's definitely for the long run, so it's really important to take care of yourselves as well. But yeah, thank you so much, everyone. We've just put our presentation in the chat, and please do feel free to get in touch if you have any questions or would like to work together on anything. Hopefully you enjoy the rest of the conference. We've really enjoyed it so far. And yeah, thank you so much, everyone, and hope to see you again in the future.
Yeah, thank you. That was amazing to get you all here.
Thank you, everyone.
You're doing great work.
Thank you.
I'm just going to hang on the line for just a second to ask you, do you do public speaking besides this?
Yeah, we do. A few of us do. I do quite a bit, and the rest of us are all practicing and getting better. So yeah, we.
I teach a class on movement building at the University of Minnesota. And so it's climate change empowering a movement. And we just finished up for this semester, so we'll be teaching it again next spring. But I would love to have one of you come into the class virtually and talk about what's going on in Europe. Because I think the more we hear each other's stories and can be inspired by what people are doing, the better. So I'll put my email in the chat, and then if one of you can connect with me, I would just love to make that happen next year.
Yeah, that would be so fun. Thank you so much. That's such a
Yep.
such a kind offer. We'll definitely be in touch about that.
Great work. Thanks so much.
Thank you. Hannah and Ola, let's hang around for a bit in case anyone wants to hang out, but then also so we can debrief together after.
Okay.
What I'll do actually, guys, is I'll end the meeting and then I'll ring you. Thank you, everyone.
Thank you.